The coronaviruses are a large family of viruses that we usually see circulate in the community every year. So when people get sick with the flu, oftentimes it's more likely to be the coronavirus than the influenza. These are viruses that we see pretty regularly. The only issue with this one is that it's a novel virus, and so we haven't seen it circulate in the community previously. And this one is turning out to be a little bit more severe than what we usually see. I think it's really important everyone keep calm. Okay, this is not the zombie apocalypse. This is not going to be the end of the world. The situation is fast moving and it's changing rapidly, but people need to remain calm and listen to health authorities. This is one time where you really want to be listening to people like our Chief Medical Officer and the Chief Health Officers from our states and territories. We have been preparing for an event like this for many decades now. One of the best things you can do is regular hand washing. So using a hand sanitizer, but also just soap and water is great. Cough and sneeze etiquette, so cough into your elbow, not into your hand, and also avoiding people that are visibly unwell. A lot of our data is actually based on what we've seen in China, and what we've seen there is that around 90% of people develop a high temperature, like a fever, and around 70% of people develop a dry cough. More than 80% of people that have been infected with COVID, that's all they're likely to demonstrate or exhibit. So in the event that you've actually contracted COVID-19 and you are unwell with it, it's really important for you to try and isolate yourself from other people, because that breaks the chain of transmission. Even though you may only develop mild symptoms, have a think about the people that are around you. Have a think about your family members, it's your parents and your grandparents, who are ultimately at greatest risk of this virus at the moment. Should we be stocking up on face masks? The answer is no. And there's a few reasons for that. Number one is it's actually our healthcare workers who are on the front line of treating people that really need the face masks. And like anything, there's a limited supply. If people are well, there's no need for them to be wearing face masks. I really can't explain why people fixated on the toilet paper issue. It's not something that you can eat or really do much with. So you don't need to stockpile. You don't need to sort of rush out to the shops and buy a huge load of toilet paper. Australia also has systems in place to make sure that people can still get things like food and supplies. At the moment, what we're sort of seeing is that we've got around 118,000 cases, or it'll probably go up to 120 tomorrow, on a planet of around 7 billion people. So the risk of individual exposure at the moment is still quite low, but obviously we've seen that some countries are worse affected than others at the moment, and obviously our government has put in place travel bans from some countries. So people really need to weigh up the travel destination, their own personal level of comfort of exposure, as well as look into what are your travel insurance arrangements. So are you going to be covered in the event you have to access medical care? Be nice to each other. This is a virus which doesn't discriminate. Anyone can potentially be infected with it. It's just like influenza. We need to get through this together as a society and as a community, and that's the best way that we can tackle a virus like this.